My name is Samantha Cohen. I'm a Developmental Behavioral Pediatrics Fellow at the UC Davis Mind Institute, and I am glad to be able to join you today to help teach about the treatment options for ADHD, specifically focusing on medications. The two main categories when we think about the treatment of ADHD are behavioral interventions and medications. And I'll touch just briefly on the behavioral interventions, which include classroom accommodations, providing help with organizational skills, and parent education about ADHD, as well as parent training on how to manage ADHD symptoms. What I will focus on for this presentation are the medications that can be used to help to manage ADHD symptoms. There are two main classes, the stimulants and the non-stimulants. Within the stimulants, there are two subclasses, the methylphenidate class and the amphetamine salt class. In the non-stimulant group, there is a medication called atomoxetine. The trade name is Strattera, and it is a selective norepinephrine reuptake inhibitor. And then the other group is the alpha agonists, which include clonidine and guanfacine. First, it's important to review the treatment recommendations by age. In young children from preschool to kindergarten age, the first-line treatment is behavioral intervention. If ADHD symptoms do not improve sufficiently with behavioral interventions, then the methylphenidate medication class can be used to help with managing moderate to severe symptoms. Between the ages of 6 and 11, the first-line treatment switches to medications, starting with the stimulants and or behavioral interventions, but preferably both can be helpful. In the 12 to 18 year age group, the first line treatment is medications, but behavioral therapy may still be beneficial for these children in addition to the medications. So this slide shows some of the common medications within each group. Within the methylphenidate group, there are short and long-acting medications. For example, Ritalin is a short-acting medicine, whereas Concerta is a long-acting medication. And there are different formulations, so there are tablets, liquids, and patches, and I'll show a slide in a little while that has pictures so you can see what I'm talking about. Within the amphetamine salt class, their common medications include Adderall, which comes in both a long and short-acting form, and Vyvanse, which is a long-acting medication. On the non-stimulant side, guanfacine and clonidine both come in long and short-acting formulations, and you can see some of the trade names there on the slide. And then Strattera or atomoxetine is a long-acting medication. Overall, the stimulant medications are generally tried first because they are the most effective, but if there are side effects with a stimulant, then the non-stimulants can be tried. And this is decided individually for each patient in conjunction with their doctor. When we choose a medication, we consider a number of factors, including if the medication is FDA approved for that age group, the route of administration, and that's important because some pills, like Concerta, for example, need to be swallowed whole and can't be crushed or changed in any way, whereas others can be opened and sprinkled if they're a capsule. And for kids that have a hard time swallowing, there are options. In addition to pills, there are some liquid formulations and a patch as well. We also think about if we want to start with a short-acting medication to see how the patient responds, and then switch to a longer-acting medication versus starting with a long-acting medication to begin with. And sometimes that depends on age group, which we'll touch on later as well. Long-acting medications can be nice because they can be given before school and they'll last the whole day versus having to give a medication in the middle of the day at school if you're using a short-acting medicine. We also try to be mindful about the cost of medications and take note of if it's covered by the patient's insurance. As I mentioned, stimulant medications are used first because they improve ADHD symptoms in most people. For kids less than 5, we generally start with a short-acting stimulant, but for children over the age of 5, we can choose to start with either one, a short-acting or a long-acting formulation. You may be wondering what the difference is between the methylphenidate and amphetamine salt classes. One difference is that the short-acting forms of methylphenidate have a shorter half-life than the amphetamine salts. Both classes affect norepinephrine and dopamine in the brain by blocking the reuptake of these molecules. But the amphetamine salt class also helps to release additional norepinephrine and dopamine from the presynaptic neuron, which you can see in the picture below. The presynaptic portion is the rounded portion on top, and the postsynaptic portion is the kind of the cup that the presynaptic neuron is sitting in. So for the amphetamine salts, there may be a stronger effect because there's more norepinephrine and dopamine in the synapse. This slide shows the medications in the methylphenidate class. The long-acting medications are on the top, and the short-acting medications are below. And there are different formulations that also are metabolized and released slightly different from each other within the different medications. So for example, Concerta has a nice smooth onset of action and a smooth course over the day, whereas other medications are released, 70% is released initially, and then later on in the day another 30% is released. If a patient has side effects on one of these medications, we will often try to switch to a different medication in the same class for this reason, because there can be slight differences in the metabolism with each medication before we would switch to the amphetamine salt class or to a non-stimulant medication. This slide shows the short-acting amphetamine salt medications above and the longer-acting ones below. And below that are the non-stimulant medications. And then to the right of that, there's a table with the recommended ages for these medications. So as we mentioned, there's FDA approvals for different medications at different ages. So when thinking about the stimulant medications, there are side effects that can be seen with those. The most common is appetite suppression, and so it's important for children and or adults on these medications to make sure that they're eating calorie-dense foods, and especially in the morning before they take the medication while they're hungry. During the day they may not be very hungry, but it's still important to make sure they know to eat lunch even if they're not feeling hungry. And then as the medication wears off at the end of the day, if it's a long-acting medication, their hunger will come back. So healthy dinner, and then sometimes a bedtime snack to increase calories, and then your pediatrician and or developmental behavioral pediatrician, whoever is prescribing the medication, will also be monitoring their growth while they're on the medications to make sure that they're not losing weight in a significant way, and they'll also monitor their growth in terms of height. And normally adult height is reached even with these medications, although it may be while they're on it that their rate of height growth isn't as fast as it would be off of it. Other common side effects are insomnia. So with that, making sure that kids and grown-ups have good sleep hygiene, meaning that they have a really solid bedtime routine, and sometimes we'll also use melatonin as needed to help with initiating fatigue and sleep onset so that they can go to sleep. Other common side effects are upset stomachs or headaches, but those usually resolve within the first couple weeks of taking it, and are generally not a problem. And then we also want to make sure that with these medications we're monitoring heart rate and blood pressure, because there can be an elevation in heart rate or blood pressure, and so the physician that's prescribing the medication will monitor those vital signs whenever they come in for a visit and make sure that they're stable. It's uncommon that we see changes, but something to look for. Another side effect can be agitation or mood disturbance, and sometimes that can be seen more when they're coming off of the medication as like a rebound effect. And so that's something to watch for and let the physician who's prescribing the medication know if you are noticing that. And then lastly, the stimulants can unmask tics. So tics can be vocal or motor in nature, and the medications don't cause them, but if the child was going to develop a tic at some point, it can decrease the threshold for those to start to happen. And so if that does happen, it's important to just let your pediatrician or the person prescribing the medication know, but most commonly you don't necessarily need to stop the medication for that reason. So whenever we're starting a medication, we always want to start with the lowest dose, and then we increase slowly as needed until the patient's symptoms are controlled and we're not having side effects. If negative side effects do occur, then we can try to decrease the dose and see at the lower dose if they weren't having side effects, if that's still effective enough, or we can think about changing to a different medication. You can always start a medication on a weekend so that you can monitor and see how the child responds to the medication. And then with the extended release guanfacine and clonidine, those are also approved as adjuvants to stimulants, so they can be used on their own or they can be added to a stimulant. So for example, if at a higher dose of a stimulant medication you start to have side effects, but at the lower dose it was working but it wasn't quite effective enough, the doctor you're working with may decide to add a dose of clonidine or guanfacine to see if that can better control the ADHD symptoms without causing the side effects. So our goal is always to not to cause side effects and to make sure that we're treating the symptoms appropriately. So the stimulants work for the majority of people, but there is a possibility that a child won't respond to a stimulant medication. So if that occurs in one class, so in the methylphenidate class, then we could try to switch to the amphetamine salt class. But if you've tried a few medications in each class and both cause side effects, or there's a reason why they're not working sufficiently, your physician may consider trying a non-stimulant, and like I said, either as an adjuvant, so in addition to a stimulant, or as an alternative. So Strattera is a medication that works similar to the stimulants, and so it can have similar side effects, but sometimes a little bit less in terms of appetite suppression. And it also can be helpful for kids that have both ADHD and anxiety. Strattera can be helpful in treating the anxiety in addition to the ADHD. And then the alpha agonists we talked about before, the guanfacine and clonidine, and for kids that have trouble with falling asleep, clonidine has a sedating effect, and so sometimes that can be used to help with children who are having sleep problems. When we think about the alpha agonists in terms of side effects, they can also cause some upset stomachs and headaches. Again, those symptoms typically resolve. These medications can, instead of increasing heart rate and blood pressure, the alpha agonists can lower heart rate and blood pressure. And so again, it's really important to have the physician prescribing the medication monitor vital signs, including heart rate and blood pressure. And these medications in particular actually initially were medications that were used for controlling blood pressure, and so it's really important for these medications not to come off without the physician knowing, and a lot of times the patients will need to be tapered off of the medication instead of stopping it abruptly, which could lead to a rebound high blood pressure effect. As I mentioned with clonidine, more so than guanfacine, it can be sedating, so the medications can be given at nighttime for that reason. And if with clonidine there is a problem with sedation, you could switch to guanfacine and see if that works sufficiently. If given at nighttime, then the next day the child isn't having as much difficulty with sedation. In terms of the other non-stimulant, Strattera or atomoxetine, again, upset stomach, headache is common with a lot of medications, including this one, and usually improves with time. Again, it can be a little bit sedating, so if it is, the medication works for a 24-hour period, so you can give it at nighttime. And with this, it's a SNRI, which we discussed before, which is similar to the SSRIs, the selective serotonin reuptake inhibitors, which are used more for anxiety and depression, but those medications have a black box warning about suicidal ideation. And so this medication does too. It's very rare, but it's something to watch when you do start this medication. Make sure to let your child know if they're feeling sad or having any concerning thoughts, to always be upfront and talk about that with you and bring that to the attention of the physician. For this medication in particular, it can take a little longer for you to notice the effects of it, so it can take up to 2 weeks. So if you start it and you're not seeing any improvements in behavior, you want to make sure you give it at least 2 weeks so that you can see if it is working. And then with this medication as well, instead of stopping abruptly, it's good to taper down on the dose before discontinuing. So that should be done in conjunction with your physician. So we also want to make sure that we're monitoring the child's response to medications. So there's a few ways that we can do that. There are ADHD symptom rating scales that can be helpful for assessing improvement, and I'll show you an example of that in the next slide. And it's good to get information both from a parent and a teacher, because especially with a medication, the teacher may see the child more while they're on medication than the parent does at the end of the day when the medication is wearing off. So it's important to get both perspectives of how often the symptoms are occurring. And so one commonly used rating scale that's available, so you could look it up using this website, is called the Vanderbilt assessment scales, and there are a couple different forms. So there's an initial form with both for parents and teachers that has a list of ADHD symptoms, as well as some symptoms of anxiety and depression, some conduct symptoms and oppositional symptoms, to kind of get an idea of the whole array of possible symptoms and which are the most concerning. And then the follow-up forms focus mostly on the ADHD symptoms and also have an area to think about side effects and if any of those are occurring. And then in both forms, it also asks about the impact on relationships with family and peers, as well as school performance. So as you can see here, this is an example of the follow-up parent questionnaire. So it has a list of statements, which are common symptoms that we can see in children with ADHD, and then it asks how often the symptom is occurring. So if it's never, occasionally, often, or very often. And then on the bottom is more of the performance. So how is it affecting their school, the different subjects? Are they having problems in any of those areas? Or would you consider them to be average compared to their peers? And then lastly, it has that symptom checklist, so if anything's occurring and the severity of it. So in terms of treating children with ADHD, medication management can be very helpful for managing ADHD symptoms, but finding the right medication is often a work in progress. So there can be some trial and error. Sometimes you'll choose the right medication for your child the first time around, but sometimes the first medication that's tried may have side effects, and you may need to try a few before you find the one that works the best in terms of controlling ADHD symptoms and has the least side effects. So I want to always make sure that that is the case. They're having the most benefit with the least side effects. And then we can also help with referrals for behavioral interventions. So as I mentioned in the beginning, there are parent education groups, which have been found to be very successful. And then there's also behavioral therapy or behavioral training for parents, and especially in the preschool age, this can help parents to learn strategies to encourage positive behavior, discourage negative behavior, improve communication between the parent and the child, and strengthen that relationship. And some programs that are commonly used for that are the Positive Parenting Program, or Triple P, PCIT, which stands for Parent-Child Interaction Therapy, and the Incredible Years. And then medications in conjunction with behavioral interventions can be even more successful than medication alone. And then lastly, just discussing classroom accommodations for the school with your child's teacher and the administration.